Hello. I'm going to go ahead and call the meeting to order, although we do not have quorum. So we will not be able to vote on the approval of minutes, and we will also not be able to tackle the new business. So Skip, I don't know if there's anything urgent in there that we need to talk about. So we'll have to go till next meeting. And also, just as a heads up for board members, is that I cannot be at the next meeting in March because I have to be out of town at a conference. So I think it will be triply important that we're making sure you've got quorum, because I will not be here. What's that? I know. Yeah. Okay, so I guess, Sam, I mean, are you comfortable with doing a presentation just for the two of us, or do you want to hold until the rest of the board is here? Because I'm feeling like,
Yeah, I think we should hold.
okay,
Right, like you guys have the data that you have in the presentation, the work is like, it's amazing and it's so interesting here. So I think we would want to really be able to share with everybody.
Okay, so the only thing is that, so today we were actually just going to do like half of the presentation and do the overview of the community health assessment. Anisha won't be here next meeting because she has conference. But
What do you want, Anushka? A lot of this is the work that you have done and led. So if you want to do the first half now, that's great, or
I don't know, like I really want the entire board to be involved as well, but there's also this thing that I won't be here next month. So I don't know, we're kind of a pickle right now.
I will happily listen to it if you would like to do your half, because you put a lot of work into it. So I am fine with listening to it. So, but I'm going to leave it up to you because I don't want you to feel pressured to do it. But and Melissa, even though Melissa's here too, so even though we can't vote, there's three of us. The best three.
oh, there's
Something to vote on here afterwards or no?
Yeah, and there's Andrea as well. So now you have 4 board members that are listening. 2 are remote. So I think you should.
yeah, why don't you do the beginning part of it and then great. So, you're so shut stuff. To get rid of that. Oh, hi. Yeah. Right, so we wanted to present some of the community health assessment and the community health improvement plan, which is all this process as a whole has been called community health improvement, or CHI Tompkins during this. And this will give an overview of the process and the data that was collected and reviewed as part of this process to lead to some decisions around health priorities for Tompkins County. So a lot of this is review for many of you, but on about a 5-year cycle, we come together in our community, representatives from whole health and public health, the hospital system, social services, and other community partners to assess unmet needs and disparities in our community, propose strategies and guidance based on what we find, and then continuously monitor and track changes and progress over the next few years. So the purpose is really to identify these key health challenges through both data and also incorporating and having community voices be participating in the process, determine gaps and disparities, prioritize strengths and resources that already exist in our community or how we can collaborate and build on them, and then advance health equity, which is very much in line with our mission here at Whole Health as well. So for this process, locally, we adopted this MAP 2.0 framework, which is mobilizing action for planning and partnerships. That was developed by NACCHO, the National Health Organization. And they lay out 3 phases to a pretty comprehensive process. So it's building the foundation, which involves creating a community vision statement, telling the community story, which is the more traditional community health assessment that has 3 different parts. So we'll go through with reviewing data and collecting data, and then continuously improve and monitor in the community. So they have this very nice graphic that we use throughout the process. And again, like I said, it's a very comprehensive framework. And so this being our first time going through it, we really just did some parts of it, but there's a lot to that's recommended in the framework. And then we also created our own roadmap type graphic to be able to show our local process and some of the pieces that we use in a little bit more detail. So we kept with the phases, but it shows you the time frame that we really started at the beginning of 2024, and then submitted the community health assessment at the end of 2025. We had a very engaged steering committee with representation from about 10 different organizations in the county. And then we are now into phase 3, which is really working on the community health improvement plan, or the CHIP, or like the action plan for taking steps to really address the disparities that we saw in the review of data, and also progress steps to make over the next 1 to 4 years. And I did include here a link now to our website, which I think I included in the last packet too. That Ted, who's here, has done a really nice job putting all of the community health assessment onto the website. And so there's some summary, and then you can download different sections of the report, as well as some of the appendices. And then we'll come back to the website because we are now building out some of the data that was collected on there too. And we just wanted to include some photos as well, that we had 2 partner convenings, about 70 people each at the library downtown. One was at the end of phase 1, and the other was at the end of phase 2, to update community partners and share and be able to have some discussion. So back to the framework that we use, this MAP 2.0, it recommends these 3 different assessments. So the first one was a community partner assessment that was a survey that was sent out to a big list of community partners, nonprofits, and other health and food service organizations. I think about 70 responded. And it really went through a lot around, what is the focus of your work, and how it relates to some of the different domains that we'll go through for the community health assessment, and then also things about capacity and funding and their ability to collect data, lots of different information. And then the community status assessment was really a review of secondary data that we will show in a few minutes, and also included our primary data collection through community health survey. And then the community context assessment is about qualitative data collection. And so we did some interviews in partnership with a Cornell MPH professor. And so those 3 assessments were completed, and then together the data from those was analyzed to identify different themes and issues in our community, and use the technical term of triangulating data, that bringing those 3 pieces together to then develop issue statements. My last slide is just to bring us back to New York State, that this process is a requirement of all local health departments. And so New York State also conducts their own assessment for the whole state, which provides sort of guidance for local health departments. And so their plan at the state level, the last round of this, like in 2022, they really shifted to a framework that revolves around the social determinants of health, or social drivers of health, and these 5 domains: educational access and quality, healthcare access, neighborhood and built environment, economic stability, social and community context. And so this framework and the social determinants of health are also very integrated into that MAP 2.0 framework. So we use them sort of in partnership. And then the state really outlines the priorities that local health departments should select based on their data that they review, and also provide suggested interventions to address those priorities. So Anisha is going to go over in a little bit more in detail of the data that we looked at.
So moving on to the community context, community status assessment that we previously saw. So Tompkins County Home Health launched their community health survey in the month of January last year, and it was open for a month. It was an opportunity for the residents to take part and give their input on the health indicators and social drivers of health. So the survey was for residents who were 18 and over, and then around more than 2,000 people opened the survey, and then it was completed by more than 1,800 residents. And then another primary data source from the community context assessment was the qualitative interviews, experiences of birthing parents in Tompkins County. This part gathers the lived experiences, qualitative inputs, and local history to understand the deeper factors that shape health. The goal of this study was to evaluate the barriers and facilitators of health programs used by birthing parents in Tompkins County. The main focus of it was to evaluate the MOMS program and the HIP Tompkins program, but it kind of also captured the umbrella of social drivers of health and how it affects access. 26 birthing parents and providers were interviewed, gave birth in Dawkins County after January 1st of January 2022. So here is a graph showing the results from one of our questions from the community health survey. So the residents were asked what are the most important factors that create a healthy community. The top 3 factors that emerged as most important were affordable healthcare, affordable safe housing, and a clean environment. Here's another one from the survey again. Barriers to access varied across service types, but cost, provider availability, and long wait times were the most commonly reported challenges in terms of primary medical care, mental health care, and cancer screening. As for dental care, insurance coverage was a significant barrier. Moving on to the secondary data sources, most of our data came from federal sources and state sources, but alongside these state level and federal level systems data, our local data was also factored in, and it was essential in contextualizing health trends and identify community-specific inequities. So this is a snapshot from the prevention agenda that Sam earlier talked about. So these are all the indicators that the state measures, and they set objectives for each of the indicators, and we are supposed to track the indicators over the course of 5 years and see if and the goal is to basically meet those objectives by the end of the cycle. So there were many issues that were identified in the prevention agenda by the state as priorities in the 5 domain areas. But based on the review of the data, these are the issues that the steering committee examined more closely. And these are the ones that are well documented in our community health assessment. All are important and being worked on in the community and will be continued to work on, but these are the ones that where the magnitude of the issue was the largest and where the population was mostly impacted. So these were the specific 12, 13 priority areas that we really dived deeper in this community health assessment.
I'm sorry, just to clarify, these are the themes that came out of the survey that you identified, or these are the areas in the prevention agenda that we're looking at?
These are the priority areas from the prevention agenda.
Okay.
But these were issues were more pronounced in these priority areas. So the prevention agenda has a lot of priority areas, but then these were the ones that showed more pronounced issues for Tompkins County.
For Tompkins.
Based on all of our.
Based on the secondary
Yeah.
data and primary data and qualitative data, these were the ones that really showed issues.
Yeah, this is about like half of the whole list.
Yeah, there are around like 30 priority areas in the prevention agenda, and we boiled it down to this many because
There's only so many hours in a day.
So the partners had an opportunity to view all the data, the entire data triangulation process on October 9th of 2025. We had a partner convening at the Tompkins County Public Library where partners from the community were invited to look at the data and make informed decisions. So the steering committee really looked at all of the issues that have been documented in the chart. And these were the 5 that were voted on. That will be the CHIP priorities for 2025 to 2030 cycle. So I would also like to explain the rationale behind choosing these specific ones. Some of the priorities that were not chosen are already currently being worked on in the community that reduces the need for duplication in this CHIP framework. The magnitude of the issue and the population of these issues, priority areas impact was higher or greater, and then there is high impact, high feasibility. These issue areas have high impact and high feasibility for the 5-year cycle. They are realistic and achievable, and the community partners really have the means to support this work. And several topics that were not selected also kind of overlap with these current priorities. So they will be, if not directly, they will be indirectly addressed in the 2025 CHIP framework.
So I just wanted to bring up the website one more time to also show that we've been building out data right on the website. So for example, for misuse and overdose, you now can look at some of the data right in the website. And so I could give an update, but we're getting, you know, closer to having some of the highlighted data available right on the website as well. And so that's exciting too. So that's where we're going to pause for today so that folks could ask some questions, or maybe board members could also share, you know, if there are specific areas within, especially these, you know, the 5 selected priority areas, you know, that you would like to discuss more maybe at the next meeting, that Anushka and I have laid out, you know, some samples of the data that we would like the board's input on a little bit more. So specific interventions, for example, like related to prenatal care and access, and sort of what Whole Health specifically is already doing to address, you know, some of the disparities around those issues, and then what we would like to build upon or expand upon during the next few years and document that in the CHIP. But we're interested in other ideas as well. And we were also going to pull one of the interventions for chronic disease prevention. But we have several interventions selected for each of these priorities. So again, we're hoping that board members could review some of the information over the next month, and then we could delve into them more in March. Thank you. Thank you.
I have a couple questions.
Yeah, fire away. Okay, so my first, and I don't know if we can make the folks, I don't know if Andrea or Melissa have questions too. I just can't see them, so. So I guess my first question is maybe more of a process question of like, okay, so now you've identified these priorities, like how are you organizing the work of the health department around those priorities? Because that is not how you all are organized right now. So is that like a conversation that you're having? Is it that you stay in the same format you have and then people are taking one of these themes? Are you thinking about like, how are you, I guess the question is just like, how are you all actually thinking about that information now and how it's driving how you're organized and how you're doing your work?
I can feel that one.
Yeah.
So, I mean, we'll talk a little bit later. I think it actually is driving a lot of how hoping to reorganize us or the direction we are going to reorganize to be able to kind of better meet some of these needs. And so we are looking to create a division that is focused on children and families, predominantly kiddos under 5, and the services that they receive at the health department and at Whole Health. And so, that group will have a little bit of an easier time tackling some of the goals and the metrics that are affiliated with this. And I have done I would be happy to share actually, because I'm doing it in our all staff meeting tomorrow. I have made a matrix of all of our plans and goals and trying to make sure that everything rolls up to be the same. So one of our departmental goals this year is focused on prenatal screenings and increasing prenatal screenings by 5%. And again, when our teams are housed in a shared space and make up one team, it'll be easier for us to assess if we're meeting the mark on that kind of a metric or not. So we are trying to reflect these into our annual department goals so that our work is shifting in that direction. And we are all kind of focused our attention on achieving something within these priorities that fits with like the rest of our guiding documents and principles.
Right. And so I guess like, because the department is complex as well, right? Because you have this set of the idea of drivers, but then like where you're getting your funding from, and I assume where you're getting some of your funding from, it's like, okay, we also have to do those things. So like, how are you all thinking about the integration? And like, I didn't see Skip's stuff up there as a priority. So like how things that weren't identified as priorities, but are important to public health, like how are you all thinking about that?
Yeah, so I actually see Skip's work really fitting in the housing section.
Okay.
And I think a lot of the work that they do is around quality of housing and keeping secure housing.
Okay.
So I think it's a blended approach of like community partners that own and take on some of this work, and the hospital, like the hospital is the other half, or the healthcare system is the other half of this. So like there will be, lines of work or business lines, for lack of a better word, that are owned by different partners. And so some of the community partners, they might actually, like, we might not touch nutrition security really here at Whole Health. That could be owned and led by like the other folks on the steering community and the community partners that focus on. And then from our end, Sam's team will be looking at what are the right interventions around nutrition security that make sense for Whole Health to say, we think we can do this, and we think we can do this in the next 5 years. And so same for the housing pieces, it's like, there's, Cindy's HSC is at the table, the continuum of care folks are at the table, so they might have ownership of some of the housing pieces. And then in the intervention plan, Sam's going to work with Skip to reflect like, what are the sort of like quality of housing and how are we securing existing housing by improving sewer and water and things like that, and have those reflected as interventions in there. So I'm trying really hard to weave everything together so that like anything we do isn't just a standalone, but actually we're doing it because there's like 3 or 4 things that say we should be doing this one thing.
Okay, actually, that answered my third question too, because I was kind of curious about the number one, the housing affordability and stability, and how you saw yourself fitting into that topic. Okay, I have one more question, which is how are you thinking about this so it doesn't re-silo public health into historical public health, given that this is an integrated, it's supposed to be an integrated agency with it's Tompkins County Whole Health.
Yeah.
So like, how do you see the mental health side of?
Yeah, I mean,
Health in
I
that.
think that shows up a lot in the substance use piece.
Okay.
And we are also taking a look on the mental health side, specifically at, how we manage and build out integrated care. And that's also one of our departmental goals, is kind of in continuing to expand on the integrated substance use mental health care that's happening at the clinic and within our PROS program. So that kind of rolls up. And then we're looking at putting together another one of our departmental goals, which is an intervention on the CHOP, is to develop a suicide overdose fatality review board.
Okay.
That is very sort of cross-cutting and will pull from expertise on both sides of the department as well as across the community. So I am trying to make sure that when we commit our time to something, it's not something that just happens in a vacuum, unless it is one of those required things that just has to happen, it has to have a value. But anything that we're opting into, I want it to be something that is driven at least from a couple of these shared priorities, because there's also a county strategic plan that we have like commitments to. And then there's like, we have a whole health strategic plan as well. So there's kind of those 4 driving documents. Yeah.
So maybe I could ask not Jenny, because she's like, how are staff feeling about this? Because like, are you, I mean, you all are divisional leaders, right? So are you working with your staff? I mean, this feels like a little bit of I mean, it's a like continued integration, right? And change and sort of rethinking public health and mental health. But how are you all approaching the work with your folks?
Well,
I
the
mean,
work hasn't started yet.
Okay.
Yeah.
We just spoke, I think, what was it, 2 weeks ago was when we finally rolled out what the new model looks like.
Okay.
So it's still in the infancy stages with the staff, although the directional or division leaders and Jenny, we've been talking about it for quite some time now.
Okay.
What are we feeling? What are the staff feeling? What's your
Well, I guess maybe if you haven't started it yet, you probably can't answer the
started
question.
the
Like,
work yet.
I guess it was a curiosity question, just of, I mean, it's different, right? And it's change. And I guess it's what we have been talking about for a lot of years. I think it was part of the, kind of backbone of even the integration of the 2 departments, but this is starting to feel like a little bit more real, which I'm kind of excited about, and just was kind of curious how that was feeling from your end. But I can cover Jenny's ears too. But you don't have to tell me. I was.
So I willing to share. I'm feeling excited. I'm feeling invigorated. I feel the programs that are housed within my division right now are very regulatory, obviously.
Yeah.
I have always had a passion for maternal child health. I worked in that prior to being in this position. And I feel like the opportunities that we will have once we are fully realigned will better align with the services that we should be providing with our clients. I feel like there is some missed opportunity in our current structure, and with our new structure, it will feel more cohesive for our clients and our staff eventually.
Right. Thank you.
You're welcome. But in terms of the community health assessment and sort of this framework of social determinants of health, which we have been talking about now for many years, that I think, yes, as our integration continues, I think it is more embedded, but I also think that we've done some things over the past 5 years that are, we're starting to see sort of more of these connections, and staff are seeing where we do touch or fit into some of these bigger priorities like housing, through like our community health workers. And I mean, even just some of the issues that both like our mental health clinicians and nurses are navigating on a daily basis with clients that, they are coming in for one specific issue, or they, are engaged in a program for one specific issue, but then through conversation or relationship, like we learn about nutrition insecurity or housing instability or, transportation issues. I mean, many of the issues that we are, pretty familiar with as being barriers in our community, but also many of our community partners are very aware of and really actively working on. And so we also often, every time we do this process, really try to reiterate that it is meant to be a community plan, and that, as much as, especially Jenny's work in looking across these different plans and like, how do we really make, a big challenge of making departmental goals for such varied work. I think that we do see ourselves, as active participants in addressing these different priorities, but we also our role is coordinating this process and sort of bringing these partners together. I mean, the response and the engagement that we received during this round, especially, I mean, I think it's grown as in the past couple of rounds that I've been involved with, certainly has grown to really make the community health assessment like a little, I think, a little more recognizable and like something that community partners identify with and see themselves in or feel is important to their, you know, organization and mission being part of the process. And so I think that's a really big part of this plan too, is that we want community partners to see themselves in it too, and be working towards similar goals so that we can actually move the needle. I mean, when we're on calls with the rest of the state, our advocacy organization, NICHO, really did a great job of bringing together local health departments throughout this process to have discussion and meet with the state, who oversees this process, to clarify and share, you know, how it's going. That many people raise concerns and questions about, you know, if local health departments are still doing this process sort of in isolation, and choosing either different priorities, or we're all choosing the same 3 to 5 priority, that like, how are we then working together either as neighboring counties or as a whole state? Like, if housing is the biggest issue, you know, across the state, like, how are we actually aligning so that change can happen? Because it's still really difficult to address some of these things out of control. So that's just where it plays into the bigger picture too.
Yeah, I mean, you guys already kind of talked about it. Those kind of categories that you've shown us don't really fit totally in like certain buckets for each of in the department. The one that really stood out more, I may haven't even mentioned it, was the chronic disease prevention, I thought. Because honestly, over the years here, I don't remember that chronic disease really being a focus of this department as much as I kind of was expecting. And I mean, granted that we have a lot of other health issues such as infectious disease, you know, that would come up, but chronic disease, I thought was really interesting. I'm not sure how that would play out and what areas would be involved and engaged in that work, or the topics that would be covered in there. So I'm interested to see what that looks like in the future. When you give the next presentation.
Asthma prevention, and there was actually a nurse who did some work on chronic disease prevention. And I currently have a nurse in my unit who does some blood pressure checks and outreach at some sites around town. But yeah, not a super formal program. And we can certainly develop and grow that more. And this realignment that we're looking at, sort of my division would split apart and move in a different way. And there would be sort of a health education piece in my unit that would focus on tobacco, like the Healthy Neighborhoods program, but also some chronic disease prevention work, like cancer, cardiovascular disease, that kind of thing. So it's an exciting opportunity, I think.
Yeah, it's something new to me to hear these.
I don't know if it's
This area.
because of my work ancestry, as some might call it, having been at the city health department where like Tom Frieden had such a strong residual presence. But I think back a lot to his work with Bloomberg as mayor, saying, what is killing New Yorkers? Our job in public health is to tackle like what is killing New Yorkers, that, you know, and at the time, the answer was smoking, right? And high sugar. And so that is what brought about the push for smoking bans, was like out of that health department. And then a lot of the calorie labeling also came out of the New York City Health Department when they looked at that data. And so I think too, here in Tompkins County, the top 2 causes of death are cardiovascular disease and cancer, and they kind of flip-flop every year. And so I think the fact that we're not really working in that space right now is a disservice to our role in public health. And, you know, if not us, then who? From the public health lens. And so I think I am really interested in, you know, working with Rachel as we kind of think through this realignment about how to bring in more supports to bring some of that work back to focus.
I just want to add in that there was a robust worksite wellness program that was coordinated here through state grants. So when I first came in, it was 2000, 2004. We did a lot of worksite wellness out in the community with workplaces. And then again, when HSC had a grant in like 2010, 2013, 14. We also were out in the community quite a lot with worksite wellness, which was focused on chronic disease mostly.
Yeah, and then, I mean, chronic disease has been a priority in our health system for years and years. And so definitely prior to COVID and traditionally, we did do our sort of direct programming around some of the chronic disease areas. And then it's, yeah, shifted during COVID and yeah, after. But the hospital system has really picked up a lot of the chronic disease prevention work, and our partner in this process, Claire Perla, after the 2022 community health assessment that we did. What came out of that was some work groups, two that she has facilitated now for many years. One is around cancer prevention and cancer screening, and the other is around chronic disease prevention. And so they've really taken the lead on that with a group of community partners, and we've been involved in that too. So in the midst of COVID, and sort of as we've moved out, I think that Pega Health especially has taken a bit more of a lead in that, but we definitely have been participating. And so I think that is something that can continue to be built on with some renewed focus for us too. Yeah.
Great.
Thank you.
Yeah, thanks. Good question. Okay, so I'm just watching sort of time here as well. So that was a good discussion. So just to recap, what you're asking the board to do before next meeting is what?
So it's in this packet
Okay.
that there are some slides that are these graphics that we developed for our partner meetings, just to highlight some of the data in each of the 5 priority areas. So those could be reviewed, and then it's the whole report is on the website if folks want to look at any of those sections as well. And then at the next meeting, we could talk about our flow chart for creating this action plan, and the framework we're using, which again is sort of identifying the objective and suggested intervention that the interventions we've taken from the New York State prevention agenda. Some of them we've adapted a little bit, and then thinking about, what is existing work around this issue, what do we want to really find in this chip as, either short-term, medium, kind of achievable actions that can happen over the next 4 years. And along with that, realistic part or achievable part is what measures, should we be tracking around. So any parts of those, be the input.
So can we ask this, can you send an email to all the board members after this, since we have some folks not here?
Yeah.
And be really specific. Please review slides, 14 through 22, and be ready to discuss these 5 questions or whatever it is, so that we know exactly what you want us, exactly what you're looking for from us. And especially since we've got folks who weren't here and didn't hear the conversation, I think they're going to have to be able to look at that and look at your questions and be able to be like, okay, yeah, I get what I'm supposed to do, and we'll come back ready. Okay.
We'll post the recording of Sunday.
Yeah. Thank you. Thank you. Thanks to both of you. That was a really great presentation and lots of work, clearly. Okay, monthly reports. So let's go ahead and start with I think we've got the budget report in there first.
Hold that one.
Hold on. Financial summary is first, usually, yeah. And then is Jeremy's not here, is he?
No, we spoke Jeremy out of coming to every
Right.
one of these and we're
Right.
just gonna,
Yeah, I got it.
But I guess we haven't plugged him back in yet, so I should make sure we don't forget to do that.
So let's go to Dr. Claypack and the medical director report.
And I'll take any questions you have.
So measles kind of stuff.
Yes, lots of measles. Anyone online with questions for Dr. Claypack, Melissa, Andrea? Okay. How about the commissioner's report?
Yeah, I have a couple of updates here. So included in your packet, if you go past towards the appendix, there's a document that looks like this, it's blue. And I wanted to offer an update on the realignment process that we are, going through as a team. What I've included in this packet is actually, we had in December, we had a half-day session where we had some consultants came in and they led some facilitated dialogues with staff that had the potential to be impacted by this realignment. That predominantly included Sam's team, Jess's team, Rachel's team, a few folks from SCIP teams who interface with them, although environmental health is really not impacted much in this change. And so this document is sort of the summary of what we learned from staff in those sessions. I thought I would include it if you were curious. I think what I have shared with our team that I have really took away from this is that we embarked on this process where we looked at different scenarios of different ways to group programs. And in the course of looking at that, one of the scenarios asked us to kind of group programs by clinical and non-clinical. And there were 3 different groups that went through this process. And all 3 groups, they kind of arranged in that scenario about the same structure that we have today. And universally, it was very hard to come up with positives for clients in the community when they were looking at that structure. And then we also asked folks to kind of, I don't know, maybe vote's not the right word, to kind of share what they saw of the different scenarios we had talked about as the most opportunity for the community and clients. And not a single person leaving that room picked scenario 3. So to me, while this started is really like, let's start to think about how to bring together some of our maternal infant programs, which currently aren't on the same team. And also started as like, how could we elevate communications now that we really are an integrated department that should have a more central role that can kind of function department wide. After kind of going through that exercise and asking staff to be able to step away from their day to day and think big picture, sort of understanding that everyone also agreed that maybe we aren't organized the best for meeting community and client need. So that said, now that we are back into this and it is impacting people's day to day, there certainly are some frustrations, and I don't want to minimize that or paint this as though like everyone is all on board, and we are trying to work through some of those concerns. And then on the back of this, you can sort of see like a little bit of a cheat sheet on the way that we're going to be moving. So you'll see our current structure, which includes Rachel's team, which is community health and runs the gamut from communicable disease, IMS, rabies, moms, et cetera. There's Jess's team with early intervention and preschool, Sam's team, which houses communication, this health planning work, as well as community health workers, which includes some maternal infant health programs and tobacco. And then there's environmental. And in the new structure, we're going to be elevating to like a more central office, an office of communication, planning and equity, or communication and planning and community engagement. We haven't quite landed on the title. And so that will include like the communications work, our health planning work, hoping to expand into more community engagement or equity. And then we'll have predominantly 2, there'll be 3 sort of public health divisions, community wellness. This again, names are up for debate still. This will include our new epidemiologist. There'll be a team focused on disease prevention that will include communicable disease, immunizations, rabies, and then there'll be sort of this health education focus with an opportunity to sort of build out the tobacco work, which will be a full-time person, which is new, community health workers, and then the Healthy Neighborhoods program. And then we'll have this sort of children and family grouping, which will include WIC, our children with special care needs, as well as the different staff that lead maternal and infant health work. And then environmental health. And so, you know, I hear some of the concerns from staff. There's still some things that we really need to, you know, work out, really making sure that the nursing folks are staffed in a way where they can still meet the needs in some of these programs. Sometimes, you know, rabies requires more attention, sometimes it's less. So there's still discussions to be had there. But you know, I'm still excited about what this presents. I think that this is an amazing opportunity to have a better understanding of data, to actually better understand and evaluate our work and the impact that it's having on the community. I think it presents more opportunities to interface in a way that makes sense with mental health and our counterparts on that side. And I think this also provides, you know, a structure that works a little bit better for some of our operational support services, you know, our billing, our admin folks who are kind of the backbone of the work that we do and are pretty vital to being able to carry these out. And so this also allows a little bit of change on that end that I think will help them be a stronger, more stable team as well. So that's where we're at.
Questions? Comments?
You can ponder it.
All right. And so have staff seen this? yet?
Yes.
Oh,
Yep. Yeah, we're in the throes of conversations and hearing some folks out and trying to address some of the outstanding concerns and trying to, you know, I think both balance the grief of leaving a structure that maybe you've known for a really long time, which is hard.
Yeah.
And being able to see the opportunities that are, you know, available in the future.
Yeah, I actually kind of liked the comments, some of the opportunities and concern comments. I think it actually is. I'm glad that it feels like, I mean, I think people are thinking about the right questions, right? Which is like, I mean, it's hard, it's change. Right, it's gonna be different, but I think it's important that we're being, I guess I just want to support like that. I think it's important that you all are doing things that feel responsive to the community, because that's your job, right? As hard as it is for, I mean, I have some parallels in higher ed, right? As hard as things are for me, like I have to remember, like there's things I'm doing not because of me, but because I'm serving a student population, right? And so that's how I have to be organized. But I think that this is really smart about kind of thinking about, and I actually think this is one of the biggest challenges, which is trying to reorganize in a way that feels that you want, it's almost like not the resistance to reorganization, but you want, if you're going to do it, you want it to work, right? And it's like not knowing, is it going to work? And the reality is that external events can shift things again, right? And so then if you have to change again, like I think that's kind of what's hard sometimes to get your head wrapped around. I mean, at least I struggle with that. I think I'm just like honing in on that because I was like, oh my gosh, that's like coming out of my own brain right there. That's exactly how I would feel. So, I mean, I just think it's really hard work. So really commend all of you and trying to kind of follow the data and follow what the, you know, all that information is telling you about how to organize. So anyways,
The
that's what I do.
The last thing you can see in here are some of our department, or not some, are our departmental goals. There's 4 internal goals, and then there's, I think, 5 that are kind of, you know, externally in partnership with sibling agencies and partners. And I think you'll see, if you know, we don't have to read through them now, but if you take a look, you'll see, you know, realigning public health services on there, you know, assessing mental health services to think about if there's needed changes in scope, focus, or workforce practices there around advancing integrated substance use and mental health care. You'll see some of these CHA-CHIP priorities also reflected in our departmental goals and what comes out of our local service plan and our county strategic.
Well, again, I just want to say to all of you, I know that this is probably really hard and just
kind of keep at it as leaders in the department, and I think it's important, and I just think it's important for the community, so. Okay, Division for Community Health, thank you.
Yes, just three things to highlight. Number one, I have a staff nurse position open, so please help me with recruitment. Our nurse Emily left at the beginning of February, so the new position is in babies, IMS, communicable disease surveillance. So I did provide in my report like a link to the posting, and we're hoping to get that filled pretty soon. Number two, I found a really interesting handout about sort of the downstream impacts of the changes to the childhood immunization schedule. And Dr. Klebeck actually asked me to share it with board members, because there's a whole section here on public health departments, the impact to this particular sector, and what we might see, which is more outbreaks of communicable disease, which is what we handle, and more people needing vaccinated, which is also what we handle. So anyway, I can send, it's probably better to send this out by email because there's so many board members missing, but I brought
Have it on the paper one, yeah. It's
paper copies.
you show you get the paper.
Yeah.
Oh, this is the common health.
This is the common health code.
Yeah, they're great.
It's a personal.
They're my former colleagues I've worked with.
Yeah. And I do have one more paper handout. So the oral health work that I've been doing with Dr. K and with our fellow Sagrika, we are partnering with the same Cornell professor who just helped out with the childhood process, Dr. Elizabeth Fox, who did the qualitative study on parents' experiences. We have been working with her to launch an oral health study to collect some qualitative data on people's experience of trying to seek oral health, dental care for themselves and their children. We know particularly there's a big problem with pediatric dentistry, and for those who have Medicaid insurance. So we want to hear more from the community. We want to hear some voices of like how this impacts parents. They miss work, they have to drive an hour up the county. So anyway, Dr. Fox and her team are opening up recruitment. We're pushing out from like this week, basically. Please email her team. And if you're a parent over 18 living in Tompkins County and you have a child and you've tried to take your kid to the dentist within the last year, you can participate in the study, and it does have a gift card compensation for your time. So we're looking forward to hearing from more of our community members, just getting a little more sort of color and data to present to funders or to leadership on how we can design something that might address this problem. Shannon's going to push it out on our media, and we're going to hang it around town at pediatric offices and things like that. So happy to take any questions about those things.
Want to touch on our measles case? I'm realizing we
Okay.
about that. Or measles case that wasn't.
Yeah. I mean, this will probably come up we're always a month delayed, right? So we're reporting like on the month before. So in the March meeting, we'll report on February. But we did have a measles rule out over the weekend. That was pretty exciting. About 24 hours of, is this a measles case or not? We had to run, Wadsworth ran labs second time, and it was not. So we was determined it was a false positive, essentially the first time. So, but it was actually a practice run with the hospital and with community partners. There was a lot of good communication, and we learned some things. So it wasn't all bad, I guess.
So it came through the hospital? That's where the patient presented?
Well, the patient, we were actually involved right from the beginning. We were contacted by the patient's provider.
Okay.
The patient had called in saying, I have these symptoms, I need to be evaluated. And so when we know about it in advance like that, we can really help plan. So we could inform the ER before this patient showed up. We could manage the testing, make sure the testing was done the right way and sent to Wadsworth within, a few hours. So we were really involved right from the beginning.
And Wadsworth went
Above and beyond.
above and beyond. They had to run repetitive tests, and it required coming in on a Saturday when they don't normally do that. And It was really a tremendous cooperation to resolve.
And Jenny was really great leadership on sort of like, let's make sure this is really a case before we, you know, sound all the alarm bells, which it's good that we did that.
Great. Questions, comments?
I had to call Dr. DeLima's cell phone over the weekend, so thank you, Dr. DeLima, for answering my call at like 8:30 on a Saturday morning.
Good teamwork.
Yes.
Okay, Sam, health promotion. Anything more to add?
Just the only thing I want to highlight is that our we love our Healthy Neighborhoods program, and it has been proposed in the state budget to be after this round of the 5-year grant cycle, which we are in the 4th year of. And so we've put together sort of an educational impact report that you're welcome to hold on to. And Jenny's been doing, you know, a lot of educating of elected officials and others to make sure people are aware of the potential elimination of this program that's been really long-standing, and it's, you know, at least 30 years. I think some counties have had it for that entire time, and it was really rooted in asthma prevention, in fire, you know, safety and prevention, in rodent like infestation prevention, and health risks associated with infestations like of cockroaches, rats. So we've, you know, it's been a great collaboration with environmental health, who originally got the award, and continues to be, and we serve a lot of people. I've heard that the, you know, total budget of this program that is across, I don't know, 18 or 19 counties, it's really a small, large state budget, and seems to truly be like a prevention program that's really accessible to people. So it would be really unfortunate for it to end. So just wanted you to be aware.
Okay, Jessica. I don't have anything additional. Okay, and then Skip.
Yeah, so I reported on a couple of boil water orders. So I just wanted to touch on that a little bit. Those boil water orders have been released. There was one at Bailey Park. It really resulted in, you know, not a good situation for the tenants, because water was basically off except for 4 hours a day over like a 2-week period. It turned out they couldn't find the leak. They thought it was an underground leak that wasn't surfacing. It turned out it was at a home where folks go to Florida in the winter, and there was a sizable leak there that was causing the storage tank to not maintain its levels. So that was shut off. They have water back. The boil water order's been lifted, but I just want to give you the heads up that we're going to be probably working with the owner through a stipulation agreement to address the distribution system, because while you can't control a leak, you should be able to, when a leak happens, you should be able to control it once it does happen, so it doesn't disable the entire park. So we're gonna look into have them evaluate the distribution system to put in adequate valving so they can isolate the leaks in the future. So that'll be coming to the board. And I just wanted to touch on Hanshaw Village. Last week, the legislature approved the Hanshaw Village Empire State Development Infrastructure Grant to put forth Hanshaw Village as an applicant for those funds. If they get that funding, it would result in $1 million going towards the park for municipal water and sewer. And that would be on top of CBDG funding that the town of Dryden has received or will be getting for municipal sewer. So significant amount of money going to Hanshaw Village to upgrade to municipal water and sewer. So hopefully within the next 2 years, we'll see that come to fruition, which is in my opinion, is a huge win for the park. I feel like over the years, we've always wanted to have municipal water to the park, but funding has limited the ability to make that happen. Back in 2024, we had an enforcement action with Hanshaw Village to evaluate options to improve the water system. And they came back with 3 options: to upgrade the treatment system, municipal water was an option, and to drill new wells. And 2025, we spent working with the DEC and other agencies trying to find funding. And then this happened to come through. So we're really excited for the residents of the park, especially that this is now a possibility.
Great.
Yeah.
That's number 1 on that theme.
Yeah.
Right, so. Could you talk a little bit about the Asteria enforcement? Because I noticed that too.
Sure.
Like, it's
Yes.
coming back at us.
It did. Yeah, so we received complaints. I think it stemmed from a contractor who was working in a.
Is this the one we looked at last month, or this is something, we didn't look at something last month? You say it did. We didn't,
So I reported on it this month. It did happen last month.
oh, right, but it didn't come as an enforcement order to the
Oh,
board.
No, that was a few months.
Yeah, okay,
Yeah, I think, yeah.
okay.
So it was essentially it's a violation of Board of Health
Yeah.
orders because we required them to implement a solid waste management plan based on what we saw at Asteri.
Mhm.
That didn't happen. There was significant amounts of garbage overflowing in the trash rooms into the hallways, just about on every floor. So because of the nature of the complaint and the amount of garbage, we issued commissioner's orders that Jenny signed to have them correct that in a short amount of time.
Mhm.
We did go back, the majority of the garbage had been cleaned up. There was in one of the, I can't remember if it was the east or west stairwell, there was some biohazard material throughout that stairwell. That was still present when we went back. So the next step is we're going to be meeting internally with county administration and then also try to set up meetings with the city of Ithaca so we can do some more coordination around dealing with Asteri. And then at that point, after we have those meetings, we're going to likely be bringing back a resolution to the board to address those to address the violation of Board of Health orders and make some additional requirements to Asteri.
Any questions from board members on any of those? I think that's the last one. I didn't miss anybody, did I? So. Okay, anything else for the good of the group? All right, that's the full agenda, so we will go ahead and adjourn. Everybody next month. Oh, you want to see me for 2 months?
Thank you.
Have a good February, March.